curiosity why.
Matrix webcast,
Where the human spirit flies. Matrix webcast, where the human spirit flies.
Hello, welcome to the Medbix webcast. This is Raman Annam Raju. I'm the host. We're having some technical issues with the guest. We're working on it. So let me bring Susan back. Hi, Susan, how are you?
Hello, Ramana. Happy New Year. Welcome back.
Happy New Year for you, 2026, our premiere show. So Mr. Lawrence is having some problems. We got to solve that problem. Why don't you keep talking with the Happy New Year for all of you. Talk to me a little bit, and I will be back in a few minutes, okay?
Oh my gosh, Ramana, you have got to be kidding me.
Yeah.
This hello, a soliloquy. Listen, seriously, unbelievable. So we're very excited to have our inaugural podcast this evening from 2026. A very, very special guest, and he's having very special technical problems. Executive Vice President of Kaiser Permanente, Lawrence Hamilton, very special guest. We're very excited to have him here, but we are very exciting conversation. Hopefully we'll get to have it. If not, we will pivot and change gears, talking about a little bit more about what Ramon and I will be doing this year, 2026, with this show. Lots of very cool, interesting things to come. Tons of amazing guests. We have amazing lineup for January, February, and beyond. Our show is growing, so we're having a lot of fun with that. And we'll circle back around and talk to Lawrence about all the amazing things that Kaiser Permanente is doing that are just excelling in the healthcare space for a million reasons. It's a fascinating read to look at their model of care and how well it's working for their communities, for other people from, basically the entire life cycle. So I'm excited to talk to him about that, some of the research they have going on in many areas of care. So anyway, I guess right now it's looking more like the Susan Davis show. So I can talk to you that I am coming to you live from Cincinnati this evening, just up from Florida. And some of you might follow me on LinkedIn a little bit. And if you do, you saw that I was most recently in the Upper Peninsula, Michigan for the holiday. And the reason I'm bringing that up is because I barely just had time to de-thaw with a couple of days in Florida before leaving the Upper Peninsula, Michigan, where myself and my mother.
You came from I saw your background. You came from Tanzania. You are originally from England, but you went to Tanzania. You ran the healthcare system in Tanzania. Tell us a little bit of your experience in England. You did a NHS. You're part of the NHS system. Then you went to Tanzania. Then you came to the United States. Tell us all the experiences you have.
So before I do that, I just want to apologize to you and to your viewers, listeners, for the technical hitch. I have no idea what went wrong. Sometimes I could see you and you couldn't see me. We could hear but not see. Anyway, I apologize and Happy New Year. I've been lucky enough to, as you say, I was brought up in Britain and started my career with the National Health Service there. And the National Health Service does incredible work every day with high value for money. With a primary care based system that produces some impressive outcomes in terms of population health. Like many health systems, it's struggling coming out of the pandemic in terms of the mismatch between demand and supply, with significant waiting lists, significant morale issues in terms of healthcare professionals, and rising expectations on the part of the public. So trying to navigate its way through that. Has an exciting 10-year plan, which is the critics of that 10-year plan is it's things that the NHS has been trying to do for a number of years, but has struggled to do. Move more care out of hospital into the community, move from analog to digital, move towards prevention. but I still have a huge place in my heart for the National Health Service and what it aspires to do, and all of the professionals who work incredibly hard every day.
Yeah.
Then you said I had the good fortune to go and work in Tanzania, which was a remarkable.
Very different, right? You're talking about extremely different, different settings,
Yeah.
right?
Yeah.
Yeah, it was a remarkable change. So I learned a great deal. It's a system that obviously, in terms of one of the poorer economies in the world, and our ambition was to try and deliver international standard care within that environment. So it was the first organization to have ISO accreditation, in healthcare organization to have ISO accreditation in Tanzania. First organization to introduce minimal surgery, MRI. Now, since I've left, gone from strength to strength and has a cancer center there now. I think a cardiac cath lab. While I was there, we started a nurse and medical education program to train the next generation and increase the supply of healthcare professionals, both for our own health service, but for the health service in general. So an extraordinary privilege to be able to work in that environment, and you can imagine learned a great deal. And then at a certain point, I asked myself, which health system came closest to what I'd create if I had a blank sheet of paper. And that led me to apply to join Kaiser Permanente back in 2005. And every day there are things that we can and should do better. But when I stand back, it's still the fundamental architecture, I think, of what you want a health system to do, to strive continuously to improve population health, to create an environment where the best health professionals can do the best work, leveraging technology, to connect with community, to strive to eliminate health inequity. So I'm on job number 5 now in Kaiser Permanente, and it's been a remarkable ride. Clearly, the US system as a whole spends an extraordinary amount of money compared to any other health system, with very mediocre results. I think we've all seen the Commonwealth studies that study OECD nations, and unfortunately, the US is an outlier. I think when we compare Kaiser Permanente outcomes, we compare favorably with many of those OECD countries. But our challenge is both to continue doing the good work we do for our members, but also, we're very proud that we look after nearly 14 million members. On the other hand, the same statistic means that 96% of people in America don't benefit from our care. And so our challenge needs to be to continue to do great work with our members, but also find ways to be relevant to the rest of people in the US who could really benefit from a more effective care system.
The another before I bring up Susan, one of the things you did was in the Kaiser Permanente, the screening and you really took that's the motto of the Kaiser Permanente. Prevention is the number one system you took it's a very powerful. Now everybody is trying to catch up on it. So tell us what inspired you to really go after that prevention and cancer screening and all those things that you took personally and then implemented it.
Yeah, thank you. You're giving me more credit than I deserve. But Kaiser Permanente has been extraordinarily successful over a number of years, and partly it's our, a very clear mission to improve population health. And the reality is, for many health systems, even though they employ people who I think are have the same purpose to want to give great care to the patients that they see, the reality is that in a fee-for-service system, many hospitals need to increase their volume. Now, I heard a CEO recently say, "Thank goodness it was a terrible flu season, because without that, the hospital would have closed."
Yeah.
And On the one hand, it's easy to see that as a terrible statement for anybody to make. On the other hand, it's just the reality, and the hospital closing would have been terrible for the local community.
Yeah.
But the fact that we've got a system that incentivizes people to increase volume, to have heads in beds, we know that that does not deliver population health. The Kaiser Permanente model, where we do well when people keep healthy, is completely the 180 flip side of most health systems. And so, as you say, we strive to improve population health whenever we can go upstream and prevent illness. That's better for our patients. It attracts, earns the trust of our members. It fulfills the mission of most of us about why we came into healthcare. And so we continue to strive to get better each year. We're delighted our breast cancer rates are 82% against the national average of 74%. Colorectal cancer screening is 10 points ahead of the national levels. Colorectal cancer significantly ahead. Managed to eliminate health inequity between black and white people for colorectal cancer screening. So I think it's the sorts of things that many health professionals came into healthcare to do. Unfortunately, the system isn't designed to deliver those results.
Yeah.
Mr. Hamilton, do you find that it's the membership that's that key ingredient? Is it the membership that's the secret sauce?
So when we compare our membership with the community outside, there's no difference in terms of socioeconomic factors, in terms of age and race. And so I don't think the differences are driven by underlying population health. It does appear to be that once people join us and we can work hard on their preventive health, that delivers different outcomes. We had a recent study in the New England Journal of Medicine that went into some detail to try and make sure we were comparing apples with apples. And what's interesting is if you look at things like road traffic accidents that aren't really influenced by the healthcare system, our mortality rate matches the community outside. When you look at conditions that can be influenced by the delivery system, things like preventing cardiovascular stroke, things like cancer prevention, then you get a distinct difference. In fact, a 35% difference in avoided mortality. And so our members have a 20% less chance of dying from cancer and a 33% less chance of dying from a heart attack or a stroke. It's the sort of thing that, if a new drug came on the market that achieved that, it would be front page news, or that sounds old fashioned. It would go viral on TikTok.
Yes.
So I think what we need to do is try to bring that care to as many people as possible.
I'm going to tell you something, surprise you about I'm presenting something that will be really in favor of the Kaiser Permanente, why it be so successful. And I'm going to present in a minute, but Susan, you want to follow up any question? Let me ask you about, one thing, we are onslaught of the United States. I don't know about England, but in United States is getting a very older population now. People are getting older, and then there is onslaught of demand for services. How do you think Kaiser Permanente is, or anybody, all the healthcare systems, how they are matching these demands? That is scares a lot of people actually.
Yeah, I'm glad you asked that, because I think it's one of two or three of the most significant problems facing healthcare, not just in the US, but in many societies. And ironically, we often talk about how unpredictable things are because technology is moving so quickly. Demographic change does not move quickly. It is very clear, very predictable. And yet, are we ready for the growing number of seniors, either in healthcare or in society generally? I think not. In healthcare, I see basically in the US and for us, we think a lot about the three changes. One is the workforce change, many more people retiring than entering the workforce. That's happening generally, but particularly in the healthcare workforce. So we face already shortages in many specialties, in many healthcare professions. That's going to only increase. The second is as people turn 65, particularly if they've had good preventive care, they're very healthy 65-year-olds, but we know that currently, as that generation turns 80, turns 90, their utilization sharply increases, and so getting ready for that. And then thirdly, obviously the care for seniors is government funded and is funded at a much lower rate, we know, than the adult population, and many health systems won't survive. So our challenge, I think, is to transform the care that we provide for seniors to deliver great care at lower cost. So a lot of the work we're doing is continuing the work that we always do of how can we go upstream and keep people healthy for as long as possible. How can we make sure we do a lot of work to try and see who's arriving at hospital and is there a more appropriate venue that we might care for them, whether that's at home, in an ambulatory setting, and we've done a lot of work in the last year actually to look really hard at the patients who are both in the ED and in our inpatient units, and have had real success in moving those patients or preventing those patients from entering the hospital in the first place. And then lastly, I'll just mention one last thing I think is we know at end of life, unfortunately, far too many people end up in a revolving door where they're coming in and out of the ED, in and out of ICU. It's often not what they would choose for the tail end of their life. They often say they would prefer to die at home, surrounded by friends, family, and in general, we do a poor job of that as a health system. So a lot of our work is to try and make sure we understand what people's values are and that we offer care that's concordant with those values. Sorry, Susan, you wanted to jump in.
No, I was curious because there's such a trend towards hospital at home, virtual care, and I'm certain you're working in all of those areas. And another area that I'm a nurse as well as a paramedic, and there's a trend across the country and around the world for paramedics to be also contributing to that workforce. So I was wondering if you guys have been utilizing your paramedicine colleagues in pre-hospital medicine to work with your at-home teams.
Yes, thank you. That's a great call out. Yeah, it's very clear that that there's a huge role for a multidisciplinary team. So we have, I think, about 700 physician assistants. We've got 300 or 400 nurse practitioners. Obviously, for care at home, physical therapists, respiratory therapists. We benefit enormously from a diverse range of skills. And with shortages in, as I said, in many, both medical professions, but also all health professions, we need to try and ensure that everybody is working at the top of their expertise, and that we try to leverage technology so that all of the things that people don't need to be spending their time on that can be done by technology is being done by technology. Both, I see that as multiple wins, really. It's very, I think, much more satisfying for the health professionals themselves if they're doing the things that only they can do, and that we're able to offload the things, particularly things like documentation that we know sucks a ton of energy and time from people, and is probably the least favorite thing they do in their working day. So we're working hard to try and pull those things away from people.
And I assume you mean an AI intervention for that charting?
Yeah, we were one of the very early adopters of ambient listening. And so that I still hear organizations that are piloting it, and that feels odd to me. For us, it feels very established at this point. And other ways of augmenting professionals, whether it's teeing up orders to be confirmed, or chart documentation, or drafting email responses, or giving point of care advice around referrals, around treatment protocols. I think wherever we're delivering algorithmic care, there's an opportunity to leverage technology to improve what we do.
Yeah, Susan, I have a pleasant surprises for you, Mr. Hamilton. The two surprises. I'm going to present that topic. After that, we have a lot to talk about it. Yeah, we can extend for a few minutes more, no problem. But I want you to listen to this one. It matches your vision and everything in a way. I am going to play that, and let me show you that. That is, I'm going to bring you to the side. Yeah, that is the Mr. Hamilton, Lawrence Hamilton, Executive Vice President of Kaiser Permanente. I'm going to go back and start from a little bit of a one more slide. This is a, I don't know whether you know him or you related to him. He's a Mr. William Hamilton from England. He's a, he's not. I don't think, but this V Hamilton. Both are from England. Mr. William Hamilton is Sir William Hamilton. Lawrence Hamilton, not yet. Knighthood is not yet. Not yet waiting for it. So he carried a function, very interesting function. Is a physics 101 for healthcare CEOs. Why it is so important? He created a function. It is an invariant principle. What he's saying is nature has some certain things it conserves. It never violates one principle. That is what must not be violated, what must be conserved. That is the Hamiltonian function actually. It is a nature as a powerful bookkeeping. For example, it gives you energy, and then say you can do with energy with anything. You can create stars, you can create a planets, create a life. You can cook a barbecue chicken, whatever you want to do. But I wanted to have information where the energy is gone and how much you spent on it. The nature keeps track of every unit of energy. It keeps track of it, so it won't lose that one things to be conserved under any circumstances. It keeps track of it. As you know, humans, I don't need to tell you that we violate bookkeeping all the times. So physics is a complex system, survive by protecting invariance. It is a Earth's climate, for example, is a complex system. The what is invariant, what conserved there. The conservation principle is what the amount of energy coming in is has to be equal to energy going out. There is no way you can do different way. That is a conserved principle. That is a protected principle. In healthcare, we have a complex system, so we don't have that kind of what is conserved in the healthcare system. Invariance. What is invariant in healthcare system? So I came up with a mathematics is a human care capacity. That's actually that equation produces direct healing. First time we took account of the doctors inside in this equation. It is, for example, time versus attention times the expertise versus except times trust. What did this means? Time means clinical time. As you just, Mr. Hamilton is talking about, you cannot, the clinical time, 10-minute clinical time means is 10 minutes. Watching the patient, listening to the patient. All of them are 10 clinical times. Attention is a direction in this, in my vector. It tells you the how much attention is paying, not a distractions. Distraction is a vector. You are going different directions. So attention is also a quantifiable metrics. Then you have expertise. Expertise compresses, the time and everything. It compresses the compressor. Expertise is important. It gives you outcomes. And then trust. That is a communication. Trust is the one transfer that energy to the patient. So you got to have all the equation has to be there. It produces the healing. First time I came up with the mathematical formulas for that, you will be surprised. Care capacity it should be greater than the invariant principle in care capacity. It must be greater than suffering out. That means unmet suffering is a problem for the healthcare systems. That is one of the things. But so care first always, that's always Kaiser Permanente, always care. Philosophy of care. So these are non-negotiable human principles you got to follow. What are the principles laid down? Moral boundaries. Nobody should die in the streets. That is a moral boundary, for example. So experts can come back with the members. These are the things that we're going to provide you, that you need to stand with at any cost. That's what it is. Then the methodology starts. Methodology is, for example, is a algorithms. It should not have paradoxes. You know, there are a lot of times you see a lot of paradoxes here in the methodology side. That you need to avoid. A lot of these, if when you are creating something, it should not violate the principle first, the phase one philosophy of care first. It should not violate that. Number three is the implementation of the technology platforms. That should not start first. That is where Kaiser is really did a great job. Um, so what happens when invariants are missing? That's a you know what happens if there is no conserved principle? Millions of apps, zero coherence. You see the apps everywhere now, countless protocols now, infinite number of rules, no liability, no reduction in human suffering. That is a broken system that we end up with there. When you don't have a conserved principle, a conserved identity, conserved things are not there. That is what things must be protected, not violated. That is what it is. If we violate the principles, what happens? Exclusion becomes edge cases. Yeah, and all those things can do that. Harm becomes acceptable error. Capacity, opacity becomes, the transparency becomes complexity. Is accept the complexity as a part of the game. That companies worship tools become tools themselves. So that is one of the things that AI noise going on. I wanted to warn myself that when invariants are defined very clearly, automates continuity and preserves context. That preserves context is that you don't need to read all the 60, say, 10, 20 years of medical history. That it gives you, the AI can give you, all the technology can give you. Technology is a force multiplier. It does a great job in the preserving the context. Reduce cognitive load. Doctors don't need to remember everything about that patient, and they don't need to be biased, and everything makes a safety auditable. So it does a great job. Technology can do a great job. But also technology is a silent exclusion engine. It won't tell you. It silently cuts out some people. You got to be, that there's some of the outliers are all gone in that sense. You got to be extremely careful. Denials become a scores. That's, suffering, particularly other system, fee for service systems, denials become a scores. Suffering becomes acceptable error, and bias scales very silently. It doesn't tell you. So the technology is a force multiplier. It slowly picks up. Opacity becomes model complexity, as I mentioned before. So what is this in? So invariants are not goals or features or KPIs. They are non-negotiable constraints that survive hype, scale, and stress. That is a that is the key for the invariance. Hamilton said that is in physics. They are non-negotiable constraints that survive hype, scale, and stress. That Hamiltonian function does that. Bad invariance, for example, in healthcare, automate 80, you talk a lot of sales talks, you hear automate 80% of workflow, reduce 30% turnaround time. I used to say that. I was a salesman one time. Patient centric. These are all buzzwords. Innovate responsibly just doesn't have a lot of meaning to it. It is not a mathematical to accept that process. AI noise also very dangerous. It accepts that kind of a floods leaders with the KPIs metrics, creates a false precision, reward short-term optimization. These are all things you need to watch. When you don't, when you have bad invariance, that's very big problem. So extreme system stress. COVID is the best test we had. COVID is a really during the pandemic demand surge, workforce loss, supply chain failure. You see everywhere they could not find masks and everything. Information uncertainty. People get confused so much. Fear and behavioral change. Those are all extreme system stress. That is a stress you need to withstand. What constraints you have, what invariants you have that will withstand that. Access collapsed, continuity broke, vulnerability unprotected, trust eroded, cost exploded during these test times. That COVID don't break healthcare systems. It revealed what invariants are missing, what invariants were never there to start with. There is no fundamental principles are not there. That is missing there. So access as an this is an example of what actually looks like access as as a variant invariant. If you create a access as an invariant, is a fundamental to our say our company, our system, not dependent on luck, not dependent on income, not dependent on geography. You're in a rural or urban cities, not depend on timing or middle of the night or anything. Holds under stress. That is a good invariant. Access is that invariance of the good invariance of access. That is, access is not a benefit. Access is not a policy goal, marketing claim, a quality KPI, subject capacity. That is not. That is access should be that under the stress it withstands. So I tell you, who did came out highest score in this one invariant thing, Mr. Hamilton. Congratulations, Kaiser Permanente became a number one. It survived that all the goals, that is incentive, alignment, physician agency, longitudinal accountability. It is a 9.5 it score. Congratulations, Mr. Hamilton. That is the highest among all the other scores are really. If you see people, you were talking just now a few minutes ago. People survey scale is a terrible. That is the lowest you see that score was. Then Kaisinger in Pennsylvania came out next after Kaiser Permanente. So what is Kaiser Permanente? They what is the secret of the Kaiser Permanente? So this is the one I did my. That is a very powerful ring they have. A closed loop healthcare system that preserves incentives, invariance over the time. That means the people who are responsible paying for also responsible for outcome. That is really fantastic algorithm. It keeps all the other ones outliers are all outside of the system. Hospital billing, physician incentive, per procedure basis. All those are outside of the system. It took it out. So the runaway success for Kaiser Permanente is that core principle, a conserved principle. That is, in the middle, I wrote it down. If you can read that, it says that the payers are responsible for the same thing. It is in the system. Billing is also included in the system of the outcomes. Incentives are related to the outcomes. That's connected within the system. It is a fantastically Kaiser Permanente solved that. I think is that one of the greatest models I think world should learn.
You're going to have to share that slide with Mr. Hamilton. That was an awesome slide.
Yeah,
and with the formula worked out there on the bottom.
Yeah, you need to. Yeah, this is a invariance principle. What they kept it one steadfast Kaiser Permanente for years. That part of the system, they never violated that invariant principle. Either we are going to be taking care of our members. This is within the system. It's not outside of outside going there. Staff model and everything it came out. That was a runaway success for Kaiser Permanente model. They need to learn from Kaiser, everybody. That if they want to be, so nature hides its rules in invariance by borrowing invariance from physics and rigor from system engineering. Healthcare can realign with the nature's hidden code. That is a hidden code. That's what the William Hamilton says, that When these invariants are protected, healthcare rediscovers its true purpose, reduce the suffering. That's what the Hamiltonian function giving us inside secret to us. Mr. Lawrence Hamilton, both the Hamiltons, one is in spirit, other one is in reality is here. That's real life. Thank you for joining. Let me bring Mr. Hamilton back and Susan back. Uh,
So cool, Ramana. Very cool.
Can I
yeah,
just say a huge thank you for two New Year's gifts? One is the flattery of being compared to Sir William Hamilton. The second is an analysis is a lovely gift to see how well Kaiser Permanente stood up to that test. I have to say it's the first time I've ever seen a direct link from kind of physics and biology and the fundamental structure of the universe all the way through to the structure of Kaiser Permanente. I'm blown away. It's very impressive. And I will say, if you translate that very sort of rigorous and theoretical framework to how that plays out on an everyday basis, I think the idea that patients make choices about their own body, their own health, with the help of their physician and clinical team is a principle that we should all lock onto. And as we know, tragically, in much of the US, the doctor and the patient's decisions are overruled by some sort of denial process. And we see the data, up to 30% of decisions made by patients with their physicians are overruled. Or sometimes we might have government regulation that is countermanding what patients want to do with their own bodies with the advice of their physicians. So taking the principles that you just expressed and putting them in a practical, in our world where we really don't base our things on prior authorization, it's based on getting groups of physicians to define what the best way of delivering care is and clinical teams, and then trying to embed that in the system and work with our patients so they're getting the best possible care and care that meets their individual personal needs. That then earns the trust of patients to stay with us so that we can work on that prevention and keep them healthy. I'd have to look in more detail about how that maps into your structure of the fundamental physics, but I think there's something there.
Oh, it's brilliant. I was just going to say,
this-
Ramana, I'm sorry, but the invariants are non-negotiable. And inadvertently, without even knowing it, the model that Kaiser is doing, using, and performing in their community for their members is fulfilling that entire circle of the formula that was created. So non-negotiables, regardless of what you just described, Mr. Hamilton, as far as the roadblocks that our cultures have put in, our governments, our bureaucracies have put in the way, somehow Kaiser is still bursting through those ceilings and road bumps and creating care that's serving the people. So what a brilliant, I still think you need to make sure, Ramana, that Mr. Hamilton gets that slide. But on the bottom, you need to put that formula back. All those words.
Actually, I did a whole
attention.
entire study. It is a mathematical structure. This system, the formula also spit out. When there is a phase shift, when exactly the doctor is going to be burned out or the nursing staff is going to burn out, it tells you exactly, my formula tells you when that phase shift happens. It's not a gradual, it is actually phase shift. It is all of a sudden it happens. That my formula can predict that. When is going to happen, that is. So it's a lot of these things I connected all the things together. In fact, I was reading about William Hamilton, and it came out, the Hamiltonian function. Somebody was talking about it, and that all of a sudden invariance. That is missing in the healthcare system. That's what I thought. The always Susan always says to me, safety first. Cardiac arrest time. You need to save the lives. Forget whatever you have on the hand. Go and use your high hands and mind and save the life first. That is the number one priority. So that kind of a thinking is not there in our healthcare system. We don't have it. Our system is policy change, they change. The time changes, they change. This disastrous times, all of them are changing. That is a problem we have. We don't have that consistency of the that protected consistency we don't have.
So
I left you.
I wanted to add something just interestingly, because with Romana's formula, your healthcare system came out number one. But there was something else that you guys came out at the very top very recently too. And it was very interesting when Forbes came out with across industries, car industry, Costco, you name it. But your healthcare system came out number one for value. That's a phenomenal feat. I think first time ever that healthcare was even brought into that entire process.
Yeah, we were obviously absolutely delighted to see the Forbes analysis, and actually totally endorse the principles behind it. That so often in those sort of league tables, value is not the primary goal. And in fact, some of our work has been we used to measure quality over here, measure service over here, and then measure cost in a different place. And clearly for our patients, we need to bring those together. We know that affordability is the number one challenge for people in terms of healthcare in the States. And it doesn't matter how good your quality or your service is. If more and more members of the community simply can't afford, then it just doesn't matter. So we talk about providing great quality care that's more affordable is our goal. And we've done analytic work to try and bring those things together. We've only done that recently. So it was terrific to see Forbes with a completely independent analysis come to a similar conclusion.
I think that your fundamental principles are very sound. That is where you kept that you want certain things you protected from beginning onwards, and you didn't change with the time, with the politics, with anything else. You kept that fundamental principles of the company there. Mr. Hamilton, you are really truly honored to have you here. Beginning of the first is like my initial presence. We had some technical issues, but you came up back with the flying colors, and then we gave you. Actually, I want to tell you how surprising that is to me. When I didn't think about you or anybody. William Hamilton came in. I was thinking after a long time in the beginning, in the middle of my presentation, when I'm making these mathematical formulas and I'm working on the formula, it all of a sudden taught me that, oh yeah, Mr. Hamilton, they're all connected. They're from England together. They are from the same background. I don't know whether he got this sir waiting for this sir knighthood.
It's been a privilege to join you. Thank you so much. I apologize to you and your guests for the technical snafus at the beginning, but it was great to meet with you. And thank you again for the New Year's gifts. I will certainly look up William Hamilton and try and, I don't know whether I can claim some sort of lineage link. I'll be very flattered if I can. What I love about your podcast is, and your broadcast is just the breadth and depth of guests that you have, and just the stimulation of ideas and the creativity that comes from benefiting from people's insights, whatever, from a whole range of diverse backgrounds. So it's a privilege to join you, and I look forward to seeing you've got a great lineup in the next few months. So look forward to learning from others.
The privilege was ours. Thank you so very much. And no worries about the snafu. We kind of run into that often, but we're getting better on that too. We're going to add value no matter. We are one of those invariants. Non-negotiable.
Thank you so much.
Good night, all of you.
Good night. Thank you so much.
We are retelling their stories through our patented design. We are retelling their stories through our patented designs that can be worn on scrubs, t-shirts, printed on conference bags, and endless other promotional materials. Daily Wear for Medicine is the first ever of its kind to create curiosity in medicine through visual art. We at MedBricks are celebrating unsung heroes of the past who made enormous contributions to the field of medicine through our unique campaign called Daily Wear for Medicine. You can wear it, carry it, and give it.